Good morning everyone, my name is CEE-JAYE from BSM 1A section. We are going to do now is to discuss the procedure of male perineal care. First, you are going to discuss is the purpose. The purpose is to cleanse the perineal area and minimize irritation and infection and promote comfort. And there are two considerations you have to acquire. First is to prevent contamination, wipe toward the anus. And the second one is scrubbing motion should be avoided to prevent infection and irritation. Next is to gather your supplies or equipment. The equipment are small container with warm water, clean wash clothes, towel, bed fan, pad to protect the bed, gloves. There are two optional equipment you have used. The one is apron or gown, then the incontinence supplies. Next is the procedure. First procedure, adhere to standard precautions. Second procedure, explain the procedure to patient. Third procedure, place protective pad under the patient's buttocks. Number 4 procedure, place patients on the bedpan with legs bent and separated. Feet flat on bed. Drape sheet over patients for privacy and warmth. 5. Fill a small container with warm water. Check the water temperature and have the patient test to comfortable level. Pour warm solution slowly over the perineal area. And number 6 procedure, wash perineum with soap and water. Use a clean area of the wash clothes for each stroke. The circumcised stroke is start on side closest to you, cleanse area using a downward stroke beginning at the tip and moving toward the anus. And the uncircumcised stroke is retract foreskin gently to expose tip of penis, cleanse tip of penis and the cleanse rest of penis in a downward motion. Number 7 procedure, rinse by pouring warm water slowly over the perineal area. Number 8 procedure, remove patient from the bedpan. Number 9 is pat area dry with towel. If patient is not circumcised, dry tip of the penis well and then replace foreskin over the tip of the penis. Turn the patient on their side and dry back area. Number 10 is position your patient from comfort and safety. And lastly, empty and clean bedpan. Number 12 procedure, return equipment to the designated area. And lastly, discard soil supplies in appropriate containers. Then you have to require the aftercare procedure. Document in patient's record. You have the patient's response to procedure, drainage if present, appearance of skin, odor, compliance to tenderness or pains, and the lastly, report any change in conditions to supervisor.